At Weill Cornell Medicine, Department of Urology, specifically in our Women's Health Center, we treat vaginal prolapse for women. Vaginal prolapse is a condition that affects a lot of women. Up to 30% of women will end up having some surgery for a pelvic floor disorder, of which vaginal prolapse is one of them. It's like a hernia, but it's a hernia of the organs that surround the vagina, and they herniate into the vagina. And that can be the bladder, the uterus, or the rectum.
Pelvic organ prolapse by itself isn't dangerous. Oftentimes patients might have symptoms of feeling a bulge in the vagina, feeling like they're sitting on a ball. They might have pelvic pressure, sometimes some pain. The things to really look out for are if you feel like you're bothered by the symptoms of the prolapse, if you feel like it's limiting your ability to do activities, if you feel like you can't empty your bladder as well, or you feel like you're struggling to have bowel movements, we recommend you see a clinician to have that evaluated further. Things that can help with the management or the prevention of pelvic organ prolapse really center around your postpartum care. So trying to get into pelvic floor physical therapy after delivery will really help re-strengthen the pelvic floor and can help minimize pelvic floor symptoms down the road.
Some of the treatment options depend on the bother of patients. For patients who are mildly bothered or have mild prolapse, pelvic floor physical therapy can be helpful. In about 20% of women after pelvic floor physical therapy, they might see improvement on their symptoms or resolution of some of the prolapse. But when the prolapse is more advanced, that is really kind of protruding through the vaginal canal, a lot of patients need something else. And it could be a pessary, which is like a diaphragm of a plastic thing that is put in the vaginal canal just to elevate the organ so the patient is not bothered, to surgical treatments that are usually minimally invasive, done through the vagina or done robotically through the abdomen. The first thing I want a patient to know if they have pelvic organ prolapse, that you're not alone. You're not the only person who suffers with this. It's very likely that you have friends or even family members that suffer from these conditions. People just don't talk about it. I have worked very hard in my career to take the taboo away from this condition so patients are informed and they know that there are options for them.
I'm really passionate about helping patients with prolapse because I think it's a condition that oftentimes patients don't talk about, but is really important to their quality of life. I think having the opportunity to make such a significant impact with the options that we offer patients really makes it worthwhile.
Weill Cornell is unique in the way that we treat these conditions because we bring so many specialists together to really be at the forefront not only of research and discovery to find new techniques to treat these conditions, but really to prevent these conditions from happening. We also provide all aspects of surgical care. We're continuously improving our surgical technique to have more durability as well as better outcomes for patients, and we provide minimally invasive approaches. We have also really been involved and at the forefront of preserving the uterus to the treatment of vaginal prolapse.